All right. Hello. We are the MedMinders team, and we seek to create a medical reminder system to help the daily lives of patients with chronic ailments. And we emphasize the qualities of simple, approachable, and reliable. Our team consists of Sarah, Yujun, and myself, and we are all CS and EECS majors here at UC Berkeley, and we've all had prior work experience in the tech industry.
So the problem that our app addresses is that of irregular medication usage. And this is actually a very widespread problem. In clinical studies, it was shown that approximately 50% of patients that have chronic illnesses and need to take regular medication actually don't take their medication regularly. This can have very serious consequences, not just for the patient, but from an economic standpoint as well. In terms of the patient, this can lead to very negative side effects, such as rehospitalization or increased levels of toxicity, and in some cases, resistance to the drug as well. From an economic standpoint, one study says that approximately $100 billion a year are used by the medical industry to treat patients that are rehospitalized or that have complications due to improper medication usage. Patients want a solution that is simple, easy to use, and most importantly, easy to implement in their lives. There are other current competitors on the market, but these have very complicated medication reminder systems that have added utility and extra features which a patient who wants to simply remember to take their medication might not necessarily need. Also, these apps are very confusing for people that have little tech experience or are not used to working with mobile apps. Our app proposes a different solution.
So as Sarah just mentioned, the competitors in the market right now have very complicated solutions to this problem. And we decided to cut down on our initial target audience to approach this problem of keeping the app simple and cutting out unnecessary features. We are currently working with the East Bay Alzheimer community and getting direct feedback from non-tech users whose lives daily depend on their usage of medication. Working with the Alzheimer community has brought us to our design philosophy, which is simple, approachable, and reliable. For reliable, we had designed the application such that it is resilient to numerous failures. For example, if your phone suddenly crashes the next time you open the app, it will inform you of the potential medications that you have missed. As for simplicity, we have made it so that there is no scrolling involved. We believe it'll be easier to show which pages to go from. And we have made the navigation from one page to the next very intuitive and understandable. As for approachable of the app, we have thoroughly researched on the fonts, the layout, and color schemes to use for the application. Even with all the steps that we have taken, however, there are numerous things that still need to be done.
What we ask for is to have some more expert knowledge in the terms of user interface and design. We seek to improve our app so that it is accessible to potentially all patients. Furthermore, we require a larger network in the medical industry. We need a network in order to be able to distribute our application, and we want our application to reach a very wide potential user base. We want to potentially have physicians be able to recommend our app to patients and also help them set it up on their mobile devices. And lastly, we require some funds and donations to get us beyond the initial startup costs. We want to take our application to the next professional level so that not only can we just improve the daily lives of patients all around the world, but also to impact the medical community as a whole. Thank you very much. So we'll be taking questions now.
Where are you in testing? Have you implemented the app or have users?
So we have a basic working version of the app, and we've been working closely with the Alzheimer's Association of the East Bay to get feedback, and we're working through multiple iterations of the front-end design.
Can you say a little bit about how it works? Is it just set a time and you get a reminder, and your real focus is just usability of the interface? there any other features or?
Yeah, I think the main challenge that we wanted to address was having it very simple, especially for people that aren't used to the fancy swipes and pulls and things that a lot of the other medication reminder apps hold. So in essence, the core of it is a reminder app, but like Eugene mentioned, there are some additional features such as the logs to look back and look at previous records of what your medication history that you've been taking is.
I don't know this field well, and you've done good work to figure out that there are competitors, which is great. It doesn't affect all teams. But it sounds like this is autonomous, meaning that the patient is the one who's going to set the schedule. Did you give any thought to the idea that either the pharmacist or the doctor would actually set it, and they would just have to follow it?
Well, I actually mentioned when we were talking about our growing our network in the medical industry that ideally we want our physicians to recommend the app to their patients and help them set it up. So that is the ideal scenario. Obviously, though, we do need a lot more contacts and to be able to reach out to the medical community a lot more extensively. Yeah,
I think if I can just kind of build on that answer, part of the reason that we're working with the Alzheimer's Association is our first kind of target audience is people with early onset dementia who still want to be able to live at home and live autonomously, but need help with these reminders to take their medication.
And what is the business model? How do you plan on monetizing?
We're just nonprofit.
Yeah, we're actually not trying to monetize this app.
Should it be like a free app or something like that?
Yeah, so ideally we would get some donations and funds, as we mentioned before, to get this app to the next level. And we just want it presented to the medical community so that they can start using it more. And
so what are the key stumbling blocks that you guys are seeing? I heard user interface. Is that the main one where in terms of the development piece, or are there other from a business, taking go to market? Have you thought about how do you go to market? Just curious. What are the challenges that you guys see at this stage?
I think that the first issue that we addressed is the user interface aspect of it, and a large part of that is just getting a lot of feedback on it. And so working with the Alzheimer's Association has been really useful. But also kind of to step into the next part, the marketing side of it is we do need to reach out to more people and get more contacts so that we can market our app and show them that this is actually something that exists for patients who want a simpler medication reminder app.
And to add on to that answer, the hardest part about the UI design is keeping it simple. That's the whole basic of our design philosophy. And especially as we introduce more users to our target audience, it's going to be difficult to weigh which features we need to add, which color scheme we should maintain, etc.